Ontario's chief medical officer has now directed all hospitals, except for pediatric facilities, to postpone non-emergency surgeries. Hospitals across the north were informed of the change yesterday. Hospitals in southern Ontario were told last week to perform only emergency operations. The government says it's taking the province-wide approach in an effort to maximize hospital capacity. It's yet another sign of the pressure on intensive care units because of the large number of COVID cases in Ontario. Here in Thunder Bay, we have now recorded 61 deaths from the disease, and we currently have about 52 active cases for our district. Dr. Janet DeMille is the medical officer of health for the Thunder Bay District Health Unit. She joins us this morning to discuss the current COVID situation in this area. Good morning.
Good morning, Mary Jean.
So when you joined us last week, you said the situation in Thunder Bay versus the rest of Ontario is a bit like being in a boat on Lake Superior and watching a very dark cloud move across the horizon. What does that cloud look like now?
It's still there. I don't think it's really gotten any better, but it's not, directly impacting us yet. But it's maybe a bit unclear about whether it's, coming our direction and how much it might impact us. So I think it still feels very uncertain.
Now, Dr. DeMille, you often remind us to look at COVID trends rather than just those daily numbers. What trend are you seeing now?
So in our area, we continue to see what I would say is a very good trend and a very reassuring trend. It does appear like we're, whatever COVID we have here, we're holding it in check and not seeing it spread, at least significantly. It's still here, though, and it's sort of appearing in different places. But certainly what we see in the rest of Ontario or in Canada remains quite unsettling. And in particular, I do follow in, southern Ontario and the GTA because I think that's maybe one of the bigger areas that might impact us. And the new case numbers every day are still quite very high. I think maybe there's a suggestion or that things might have stabilized in the last 5 to 7 days. I'd like to see that manifest more concretely over the next few days or week. That would be really nice to see that things may have turned the corner, but it's not super convincing at this time. Mm-hmm. And certainly looking at other provinces, COVID is very clearly still here. Those variants of concerns are really leading the third wave, and it's not easy to manage.
Well, in light of that, there have been suggestions that vaccines could be redistributed around the province to help centres like Toronto and Peel deal with those high case counts. What's the latest on that talk of redistribution?
So I think, some of that has already happened in some ways because the hotspot strategy was a part of the phase 2 rollout, and phase 2 is of the vaccination plan is what we're in right now. So additional vaccine has been provided to those hotspots areas, and I think they continue to the province, work with those health units, work with those health partners to be able to deliver those vaccines in that area. And I think that's really important because those are very significant, not only for those areas, for the rest of the province as well. I think it's tricky to talk about sort of the redistribution, and because there's many things that really influence our supply that we'll get here, and that also includes the vaccine that's coming into the country, and the priority groups and how health units are moving through the priority groups, and we have. Did experience a little bit of a drop in supply in terms of our Pfizer vaccine, which I think was part of that, perhaps a little bit of that reallocation. But at the same time, we do anticipate more Pfizer coming into the country in the month of May. And so this might be a fairly temporary sort of disruption to that supply. But there's other things as well in terms of the different vaccines that are available and also some uncertainties around delivery dates that impact what we can do. I am pleased, though, in terms of the number of vaccines we're still able to deliver, although there is uncertainty as we move forward over the next couple of weeks.
Mm-hmm. Mm-hmm. We've been hearing people in communities along the North Shore of Lake Superior still waiting for access to vaccines, particularly through pharmacies and or primary care providers. When might those vaccines be available?
So the district communities are receiving vaccine, and for some of them it's every week, and one community marathon actually will be doing them every second week, but a larger clinic. And certainly we're always looking to, support all our providers in being able to deliver vaccines, and I do recognize the particular issues faced in those communities and some of the challenges, and I certainly been talking to them about that and making sure we're working with them to address what some of those challenges are. And I think we have different opportunities going forward, and certainly look to help always distribute our supplies so that it does go out to the district. Really, really hoping that supply will increase, as I've already indicated, and more vaccine can go out there. The AstraZeneca, which is the big vaccine that was supposed to go to primary care and pharmacies, I don't know quite what's happening at the provincial or national level on that, but there does seem to be some change in the supply that will be available in terms of that one dropping, and I think that might be a supply issue nationally that's impacting that. So where we're expecting sort of more shipments in the month of April, it doesn't look like that's going to happen. And unfortunately, that was the one that was going to go to the pharmacies and the primary care primarily, and we're just back at a point of having uncertainty about when that's actually going to happen. So you don't have any more notice as to when those North Shore communities might see those pharmacies or primary care providers getting vaccines? Well, they are right now. They get the primary care is getting that some Pfizer, but in terms of those other ones, even being able to provide Moderna or that AstraZeneca, we don't know. But it might be that it's being actively planned. The province is the one that does a lot of that distribution, and I think we're just waiting to hear, which is not a very good situation, but at the same time, it could change, next week where we know more, for example. Now, what, if any, changes have there been to plans around vaccinating essential workers and teachers and other educators? Yeah. So as you are indicating, essential workers who cannot work from home are a big part of Phase 2, and according to the rough timelines anticipated by the province, they would be started somewhere in the middle of May. And again, it's going to depend on vaccine supply. We are currently awaiting more refined direction and policy around that essential worker group. We have started collecting some information from those groups so that we are prepared to be able to roll out, especially if we do get more vaccine. We potentially could do some rollout earlier. And we'll be putting out more shortly about those essential workers. But again, it's a very large group. It's divided into the Priority 1 group and the Priority 2 groups, and just needing more of that guidance about the actual rollout and the order of rollout, and of course the vaccine supply to be able to do it. So how or who is deciding, whether someone is classified as an essential worker? I think there's a lot of confusion there. Yeah, and you know what? I totally agree, that there is confusion, and there are some individuals who are considered essential workers who might be qualifying, at a Priority 1 or Priority 2, and there's others that might do something that would have a very similar risk level, and they might be classified a bit differently. And that I do agree that doesn't feel right, and that doesn't feel particularly comfortable, and it is just the way the rollout is sort of happening. But there is a list. So if you go to the Ontario Vaccination Plan and or our website, actually, we do have a list of the groups and how they're described, and in those two priorities. And so that does define a bit of who the essential workers who cannot work from home are. And then again, there is more in-depth guidance that we have that's also available online, but we are expecting more. And then there is policy direction that might be set by the ministry. For example, the recent change in policy that we were moved forward on special education workers. That was a policy direction that was communicated, I guess, a couple of weeks ago now, and we did move forward, as did other health units, around immunizing that population. So we may, anticipate getting some additional policy direction, even, any time really around that.
Mm-hmm. Thunder Bay City Council has said if this region's going to get less vaccine because we're not a hot spot, the government should maybe open up outdoor spaces like golf courses or courses, tennis courts, that kind of thing. What do you think about that?
Well, I do understand that, we want to be treated fairly and, given our COVID situation and, of course, with the vaccine. And, I think it is tricky because there's a lot of uncertainty as it relates to COVID, and the government has chosen to put their latest emergency orders in the stay-at-home order as a provincial-wide direction, and so it does apply to us. And of course, it doesn't really allow those things to be open, and there's very significant limitations on any gatherings. So really, you're not really able to do anything, even outdoors, with people outside of your own household. So it does, that's the direction that the province has chosen, and it's really because of the ongoing COVID-19 situation in our area, and I do understand the challenges in those decisions that they have to make. I'm not sure that one can sort of play off the vaccine supply and those restrictions. I think the restrictions are in place to prevent the spread of COVID and the variants of concern. And the vaccine, of course, is to try to protect the broader population. And we are doing, I think, well compared to the rest of the province on vaccine. I think that we just our supply and some additional vaccine that we did receive in February and March has put us, I think, a little bit above average in terms of our progress. And so that will also figure into what the government is going to do around the vaccine supply.
Listen, as always, thank you so much for taking some time to speak with us this morning.
Yeah, thank you very much, Mary Jean.
Stay well.
Okay, you too. Bye-bye.
Bye. Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit. Thunder Bay District Health Unit. Thunder